How is chronic lymphocytic leukemia prognosis? Explained simply. Imagine being told you have a slow-growing blood condition called chronic lymphocytic leukemia. It might sound alarming, but understanding what it means for your future can help ease concerns. Chronic lymphocytic leukemia is a type of blood cancer that affects a kind of white blood cell called lymphocytes. It usually develops gradually, often over many years, and many people live with it for a long time. The outlook, or prognosis, depends on several factors but is generally considered favorable compared to other types of leukemia. Most people diagnosed with chronic lymphocytic leukemia can expect to live for many years. About 87 to 88% of adults survive at least 5 years after diagnosis. However, survival rates can vary based on certain risk factors. For example, people with low-risk disease, identified through specific genetic tests and clinical features, have a higher chance of surviving 5 years or more. Conversely, those with high-risk features may have a lower survival rate, but even then, many live for several years thanks to advances in treatment. Since chronic lymphocytic leukemia tends to grow slowly, many patients do not need immediate treatment. Instead, doctors often recommend watching and waiting, monitoring the disease closely. When treatment becomes necessary, options like targeted drugs, immunotherapy, or chemotherapy can help control the disease effectively. Even when treatment is needed, many patients experience periods of remission, where the leukemia is very low or undetectable, allowing them to enjoy a good quality of life. Age plays an important role in prognosis. Younger patients under 60 generally have better outcomes, partly because they tend to be healthier overall. Older adults may face additional health challenges that can influence survival, but they still often benefit from modern therapies. The genetic makeup of the leukemia cells also helps doctors predict how aggressive the disease might be and how well it might respond to treatment. It's important to remember that prognosis is based on averages from large groups of people. Every individual is unique, and some may live much longer than expected, while others may have a more aggressive course. Advances in medical research continue to improve treatment options, helping many people manage chronic lymphocytic leukemia as a chronic condition rather than a rapidly progressing disease. In summary, the outlook for chronic lymphocytic leukemia is generally positive, especially for younger individuals and those with less aggressive disease. Many people live 4 years, managing their condition with regular medical care. To get the most accurate and personalized information, it's essential to discuss your specific situation with your healthcare team. They can help you understand your prognosis based on your health, disease characteristics, and the latest treatment options available.